This unit is on the respiratory system. For the respiratory system, there are 4 processes linked to respiration. There is pulmonary ventilation, that is moving air into and out of the lungs. There's external respiration, that is the gas exchange between the lungs and the blood. There's transport, and that's when the gases of oxygen and carbon dioxide are transported through the body in the blood. And then there's internal respiration, and that is gas exchange between the systemic blood vessels and tissues. In terms of the respiratory structures, they can be divided into the conducting zone and the respiratory zone. The conducting zone are anatomical pathways. So air is going to move through the conducting zone, and the conducting zone will carry, filter, warm, and humidify the air. So this includes the nose and the nasal cavity, the pharynx, the larynx, the trachea, the bronchi, and the bronchioles. The respiratory zone is the site of gas exchange. So this is the physiological part of the respiratory system. And these are structures that are within the lungs, like the alveolar ducts and the alveoli. So this is just showing the conducting zone compared to the respiratory zone. We'll start with the upper respiratory system. So we have the nasal cavity. These are chambers within the internal nose, and the air is inhaled into the nasal cavity. It's warmed, humidified, and cleaned. The nasal cavity leads to the nasopharynx, and it contains the external nares or nostrils, which are the nose openings, the vestibule, which is the area superior to the nares, or if you were going to stick your finger in your nose, you'd be sticking it in the vestibule. The vibrissae, which are the nose hairs that are lining the vestibule, they function in tactile sensation as well as trapping of particles. And the epithelial cilia, which are smaller hairs that are lining the nasal cavity, and they too are to trap particles. The roof of the nasal cavity is formed from facial bones. The floor of the nasal cavity has 2 parts. There is the hard palate and the soft palate. The hard palate is the anterior portion, and that is formed from facial bones. The soft palate is the posterior portion, and it's formed from muscle and connective tissue. If you run your tongue along the top of the roof of your mouth, you'll actually feel the hard palate anteriorly, and then as you get more posterior, you'll feel how it turns soft, and that is the soft palate. Mucous membranes line the nasal cavity. They produce mucus, which functions in trapping particles. Mucus also contains enzymes that's able to kill bacteria and other pathogens. And then the nasal septum divides the nose into 2 different halves. This is just showing you what a deviated septum is. It's when the septum is not dividing the nose into equal portions, and a deviated septum can actually impede breathing. A perforated septum is when there's a hole in between the 2 nostrils. There's a hole within the septum, and so air can actually move from one to the other. So moving on to the next part of the upper respiratory tract, and that's the pharynx. The pharynx is commonly called the throat. It is a funnel-shaped tube of skeletal muscle. It connects the nasal cavity and the mouth with the larynx and the esophagus. The pharynx is divided into 3 different regions. There is the nasopharynx. Naso means nose, so the nasopharynx is directly behind the nasal cavity, and the nasopharynx is only an air passageway. The uvula is the projection of the soft palate, so it's that hanging structure in the back of your throat. It actually flips up when you're swallowing. And when it does that, it closes the nasopharynx and prevents food from entering the nasal cavity. Next section of the pharynx is the oropharynx. Oral means mouth, so this is directly behind the oral cavity. The oropharynx is both an air and food passageway. And then the third division is the laryngopharynx. Laryngo means larynx, and so this is the section that is connected to the larynx. This too is an air and food passageway, and it extends to where the respiratory and digestive paths split. So the respiratory pathway is going to go into the trachea. The digestive pathway is going to go into the esophagus. The epiglottis closes the respiratory pathway when swallowing. So when you're swallowing food, the epiglottis will actually flip downward and close off the larynx, leading to the trachea. So food has to slide behind it and go into the esophagus. Next, we have the larynx. The larynx is commonly called the voice box. This is the respiratory split from the laryngopharynx. The structure of the larynx, we have the epiglottis like we talked about. The epiglottis is cartilage that will close and cover the larynx when you're swallowing. There's also the laryngeal prominence. That's commonly in males called the Adam's apple. If you feel the front of your throat, you'll feel this piece of cartilage. It is in both males and females. It just grows larger in males and it's more prominent because of testosterone. Testosterone causes the structure to grow larger. Its function is to be a shield protecting the vocal cords which are behind it. So this is just an animation showing how when you swallow, the epiglottis closes the larynx. Inside the larynx, there is the glottis. The glottis is the opening in the larynx. So this is the pathway that air is going to travel. We also have the vocal cords or the vocal folds. And we've got both the true vocal cords and the false vocal cords. The true vocal cords are what actually vibrates to produce sound. The false vocal cords are also called the vestibular folds. They do not produce sound, but they function in closing the glottis. And so you can see in the pictures on this slide where the true vocal cords are, where the false vocal cords are, and what it looks like when the glottis is open as opposed to when the glottis is closed. So here you can see the vocal cords opening and closing. So you can see the glottis, the opening right there, and then it once again closes. This is a video you can watch of the vocal cords.